We're going to discuss few question and answer for Nclex licensing exam. The first question here, a client is ordered lisinopril for the treatment of hypertension, and he asks the nurse about the possible adverse effect. The nurse should teach him about which common adverse effect of angiotensin converting enzyme, ACE inhibitor. Select all time. As I told you, lisinopril is used to treat high blood pressure, but it is important to know before use this medication, we have to follow a few precautions, like do not take this medication if your patient is a pregnant, right? Also, it may make you dizzy, and dizziness is a side effect. What else? What are the other side effects? Number one, constipation, dizziness, headache, hyperglycemia, hypotension, and impotency. So the correct answer here, dizziness, headache, and hypotension. Usually constipation is the most common calcium channel blocker like amlodipine. Dizziness, headache, or hypotension is the most common symptom, adverse effect of lisinopril. So rationalists say dizziness, headache, hypotension are all common adverse effect of lisinopril or other angiotensin converting enzyme inhibitors. Lisinopril may cause diarrhea, but not constipation. Lisinopril is not known to cause of hyperglycemia. Hyperglycemia can, usually cause the diuretics like furosemide. So it is important, if your patient needs to furosemide, educate your patient to adjust the insulin level if they have diabetes. What else? So if my patient needs to take lisinopril, it is important be careful not to stand up quickly after take this medication, because chance to develop postural hypotension. Also, it is good to drink fluid and try to avoid getting too hot. And tell the doctor if some dry cough, swelling the lips is developed, right? Even it is important in inform healthcare provider if we see the slow pulse, right? So it is important to check the blood pressure regularly if my patient needs to take lisinopril. What next? A client is admitted to an acute care facility with pneumonia is an infection of the lungs or an infection of the air sac in one of both lungs, characterized by severe cough, fever, and difficulty of breathing. What else? When ausculting the heart sound, the nurse note fixed split of the sound, heart sound S2. A pathological split that does not vary with the respiration. A fixed S2 split is the hallmark for what? So if you are healthy or healthy adult, there are normal heart sound, often described as a lump and dub. And this sequence with the each heartbeat. And these are the first heart sound we call S1, and second heart sound we call S2. And S1, S2 follows by the closure of arterioventricular valve, and semilunar valve respectively. But here the question, if S2 is split, what does the indicate? Right bundle branch block to self left bundle branch block, 3 arterial septal defect, and 4 aortic stenosis. The correct answer is atrial septal defect. What are the rationale? A fixed S2 split is the hallmark of arterial septal defect. This split, which is a continuous and does not vary with respiration and result from prolonged emptying of the right ventricle, a right bundle branch block causes a wide S2 split and that louder on inspiration than on expiration. This split results from delayed depolarizations of the right ventricle and left pulmonary valve closure. Left bundle branch block or aortic stenosis and patent ductus arteriosus cause the paradoxical S2 split, right? So hard only on expirations, a paradoxical S2 split result from delayed aortic valve closure. So if any student asks me, what is split S2, right? Usually the S1, S2 is fixed. The fixed split S2 is a effect that causes the wide closure time between pulmonary and aortic valves, right? And we can hard it with a stethoscope. So two valves should close at approximately the same time. And fixed indicate a hole in the septa in between the ventricles. What next? A nurse is caring for a client who is recovering from a myocardial infarction. The cardiologist referred him to the cardiac rehabilitations, which statement by the client indicate an understanding of cardiac rehabilitations. So myocardial infarction, also known as heart attack. So damage the heart muscle caused by the loss of blood pump due to the blockage of arteries, right? Very important to know. So here, if patient have it, definitely they will present to you with few signs and symptoms like discomfort in the chest region, pressure or tightness over the chest, pain or discomfort in the arm, back, neck region, or excessive sweating. Shortness of breath, sometimes patient complain nausea, vomiting, and dizziness. So if my patient have it, it is important to know what are the underlying cause, how we can prevent it, and what are the complications. But here the question talking about the cardiac rehabilitations. So if when I finish the rehabilitation program, I will never have to worry about heart trouble again. I would not be able to jog again, jogging, even rehabilitation. Rehabilitation will help me function as well as I physically can, for I will get rest during this rehabilitation classes. And all I have to do is sit and listen to the instructor. The correct answers say rehabilitation will help me function as well as I physically can. Rationale. The client demonstrate understanding of cardiac rehabilitation when he start start that it helps the client reach his activities potential. And coronary artery disease, which typically causes acute MI, is a chronic condition that is not the cure. Many clients who suffer an acute MI can eventually return to such activities like jogging, depending on extent of cardiac damage. Cardiac rehabilitation involves the physical activity as well as classroom education. So if you ask me, what are the cause of um, myocardial infarction? Hmm? So there are some factors associated with increase the risk of heart attack or MI, like age, high blood cholesterol level, diabetics, genetic problem, family history, or any kind of heart surgery, high blood pressure for a long time, obesity, or of right? Even excessive stress. If anybody have it, it is good to educate your patient to prevent. How we can prevent it? So some preventive measurement to overcome the heart attack, and it is include like uh, not to smoking, eat a balanced and healthy diet, stay active, and get plenty of exercise, get plenty of good quality sleep, and keep. If you have diabetic, control the diabetic, and also keep the alcohol intake down, maintain blood cholesterol at optimum level, and keep the blood pressure in control also. Maintain a healthy body weight. And last one, it is good, avoid the stress. Like we have to know or we have to learn how to manage the stress, and you it can prevent the heart attack. Next question. A nurse is teaching a client who will soon be discharged with a prescription for warfarin. Which statement should the nurse include in discharge teaching? A. Eat more yogurt and broccoli. 2. These drugs will dissolve any clot you may still have. 3. If you miss a dose, double the next dose. And 4. Don't take aspirin while you taking warfarin, right? So warfarin is a blood thinner. Warfarin, the common brand name is Comadin. And warfarin, basically this medication is used blood clot like deep vein thrombosis or DVT, pulmonary embolism, and or to prevent the new clot from forming in your body. So, but when we prescribe this medication, it is good to know about these drugs, how they interact, what are the dose, and what are the side effects. What are the answer for this? It is what are the include discharge staging. 4. Don't take aspirin while you are taking the warfarin. So drug and drug interaction important to know. So before taking this medication, it is good to educate your patient, like in blood disorders such as anemia, hemophilia, or breathing problems such as bleeding of the stomach, or blood vessel disorders such as aneurysm, or any research measures such surgical operation, kidney disease, liver disease, alcohol use, it is important to evaluate. So, rational say because aspirin decrease the platelet aggregation and also interfere with clotting, right? So use of aspirin with warfarin and anticoagulant may lead to excessive anticoagulative effect and cause the bleeding. Warfarin therapy is the most effective with consistent dietary intake of vitamin K, also include intake of, food rich in vitamin K or such as broccoli could change the client warfarin dose requirement. And although warfarin interrupts the normal clotting cycle, it does not dissolve the clot that have already formed. The client should take warfarin accurately the order to maintain the desired level of anticoagulations. Double a dose could cause the bleeding.